Hi, my name is Dr. Cyndi Matthews, and I'm here to talk to you today about gender-aware therapy. Gender-aware therapy was developed by Glenn Good, Lucia Gilbert, and Murray Scher in 1990. This type of therapy is also known as gender-sensitive therapy. It originated from feminist therapy, and feminist therapy takes into account women's issues and problems from a social perspective and a social context. It was created to expand the concepts of feminist therapy to include men, women, couples, and families. Now, before we get started talking about gender-aware therapy, it's necessary to talk about the difference between gender and biological sex. Gender is defined as the psychological and sociocultural constructs concerning masculinity and femininity that can change over time and also over culture. Biological sex differs from gender in that it's based on physiological characteristics instead of psychological characteristics of males and females. And this is determined by hormones, chromosomes, genitalia, and internal organs. When we're talking about gender-aware therapy, we're talking about social constructs and psychological constructs. Gender-aware therapy integrates non-sexist theories for both men and women and examines the social constructs and the context of both men and women. Multicultural perspectives can also be taken into account at the same time when exploring the client. The goal of gender-aware therapy is to assist counselors and clients with creating and living in non-oppressive environments free from gender stereotypes and prejudices. Now, from a historical perspective, in 1975, the American Psychological Association determined that psychotherapy was biased against women. They found that traditional therapies were found to subjugate women and that the techniques and theories promoted traditional sex roles and also devalued women. The task force also determined that counseling was analogous to the social order of men or the counselor subjugating women as clients, with men determining what women need. Gender-aware therapy realized that male gender stereotypes may also psychologically damage men. So gender-aware therapy, or GAT, was intended to synthesize the principles of feminist theory with gender theory to equally represent both men and women. There's 5 major theoretical underpinnings. Number 1, gender is central to counseling and the counseling relationship. Gender role socialization and messages to both males and females need to be taken into account. Number 2, issues need to be considered within their socio-political context. The personal is political. Number 3, gender inequity occur for both men and women. Stereotypes and implications need to be explored for both men and women. Number 4, egalitarian relationships need to happen between the counselor and the client. Number 5, counselors need to have respect for their client's abilities to be able to make their own choices. When we talk about women in particular, if a counselor were to see a client, we need to figure out the socialization of women. Women have been judged traditionally on male counseling models that emphasize achievement, individualism, and cognitive problem solving. But in contrast, women have been socialized to emphasize collaborative interpersonal relationships, being intuitive, and having holistic problem solving methods. So how they've been socialized, then they're going to be judged by counselors and psychologists as being less than. Women have also been socialized to suppress anger, to please others, to become caretakers, and take the blame for situations. And this type of situation, or this type of socialization, can increase anger and even depression. So when you're working with women through GAT therapists can explore with women, taking into account the social, the cultural, and the biological issues of women. They can explore roles of being a wife, a mother, a worker, a community member, a family member, what that means for the woman. They can talk about career development, balancing work and family, and finding mentors and support for the woman. Body issues relating to eating disorders and body image distortions can also be discussed. Issues regarding sex in society can also be discussed, especially when there's always double standards for women, well, most of the time, when it comes to sex and the role in the relationship that sex plays. Sexual trauma, such as rape, sexual harassment, and sexual abuse can also be discussed. Gender-encoded messages sent to women, them being too strong, that they need to submit, that they're not supposed to question, or that they have to be sexy, or they're not allowed to be too smart, those kind of messages can also be explored with the women. Physical changes that mark a woman's life, such as menstruation, pregnancy, and menopause, can also be discussed, not only through the hormonal changes that occur, but also the likelihood of some depression that may occur. Utilizing GAT with men can explore traditional and stereotypical roles and attitudes that they've been socialized with, such as being independent, autonomous, invulnerable, and blocked from their emotions. Men often play out different scripts that are prescribed to them, such as the tough guy script, being aggressive and fearless, the violent script, which encourages violence and aggression through sports and fighting, the playboy script, where sex is seen as gratification of physical needs and not about intimacy, the homophobic script, where intimate connection with men must be avoided, or the winner script, that men have to be overly competitive and successful, becoming very overly authoritarian and aggressive in relationships as a result. Also, the independent script, that men must not attach to others or they'll be seen as weak. Scripts can cause conflicts between work and family and in relationships. Each script can be explored by counselors and clients, and they can be challenged and possibly changed, looking at the positive and negatives of each script. With couples and families, each of these scripts of each partner can be explored and looked at in terms of the relationship, such as household chores, childcare, not belonging to one gender, but things that need to be done and that the couple has agreed upon together. Intimacy communication patterns can also be explored, and sexual intimacy as well. The techniques of GAT include the counselor being aware of gender scripts and their own gender socialization, being able to confront themselves with their own issues and also look at their clients' issues, exploring the problems in gender and social context by educating their clients, perhaps using a gendergram, which is like a genogram, except looking at the gender roles that each person may have played in their family and where they got their messages from. Of course, education and exploration of alternatives and consequences can also be helpful, such as bibliotherapy, modeling, working some things out, discussing with the counselor, always helping move the process forward. Termination is a great part of GAT because it helps the men realize vulnerability of saying goodbyes is okay, and for the women it can encourage self-reliance. Therapeutic process, of course, includes the egalitarian nature of the counseling relationship, respect for the choices of the clients, advocating for change in society, understanding everything in a social context, and understanding traditional gender roles, and focusing on strengths of both men and women, and not feeling like just because they may do something traditionally female, that doesn't necessarily have to be a bad thing. It encourages a wider range of behaviors, thoughts, and feelings for both men and women. Thank you very much.